Joining me now is Dr. Scott Masson. Scott, thank you so much for joining me today.
Not at all. My pleasure, Tanya.
Great. We're in the midst of the pandemic. Various countries have imposed different measures and whatnot. How's this affecting society as a whole? Or is this now that we're several, months, I guess we're entering week 11 now, the lockdown, is this still the right response? Have we gone too far?
Well, I've been mulling this over for a considerable time. Like most people, I've had a bit of time on my hands at home and able to think, and I do about that sort of thing anyway. Um, uh, the way I've tried to understand this myself is in the context of the language that the authorities have been using. They've called it a war on the virus, declared the COVID-19 to be an invisible enemy. That's the language being used by our prime minister, by the president of the United States and others. And with that in mind, it seemed to me appropriate in some ways because what they were doing by declaring a war on the virus is depriving their citizens of their rights and freedoms. And those things only happen in the context of war. That the cessation of civil liberties is even permissible. And so it happened at first temporarily, or at least it was said to be temporary. And the reason we were going to do the shutdown or the lockdown, and that's prison language, right? We're going to lock down everything, was to prevent the healthcare system from being overwhelmed and to try and flatten the curve. So that was the original rationale. So when they first declared that, I was like everybody else who probably thought, oh, this is terrible, but it's probably justified. And there were all sorts of experts that were being quoted out there. One in University College London, Neil Ferguson, who had these wildly catastrophic projections based on computer modeling, which has now proved to be, totally bankrupt.
We have actual data. We don't need to rely only on modeling. We actually have a few months worth of data collected.
Correct. But at the outset, we didn't have that. We only had modeling, and it was based on hypothetical scenarios and also the unknowns about the nature of how virulent the virus actually was. And we saw that China had shut down a few provinces very aggressively, and obviously that was going to give them a huge economic hit. And countries don't do this unless they think there's a terrible danger. So our countries, in accordance, did the same thing. So it seemed reasonable at the outset, and people went along with it. But now we do have a rather different situation. But the original declaration of a war on the virus, even at the outset, has, I'd like to bring in the idea of a just war, a notion of a just war here on this. There are three conditions for a just war. First of all, it has to be from a rightful sovereign. So the person has to be legitimately an authority over this particular threat. Secondly, there has to be a just cause. And then thirdly, the intention has to be good. You have to be trying to promote good and to avoid evil. Okay, so at the outset, you might have said that the national government was the rightful sovereign here. I actually disagreed even at the outset, because it seemed to me that what the national government or the federal government in Canada, their sovereignty is over the borders of the country. But they let the borders open even after there was a threat there. And once the virus had passed over the border, they were no longer the sovereign that had jurisdiction over what was going to happen with the virus. I think the federal government at that point has abrogated its responsibility or its ability to stop the threat, because now the virus is here. So there's the question of that at the outset. But let's just leave that objection aside. Let's say that they were initially they were rightful in their judgment, and there was a just cause, and they did that on the basis of modeling, and they were trying to avoid evil. Okay, now we have something better than what we began with. We began with projections and computer models. Now we have a known threat, and we have statistics that measure how terrible the threat is. And there's no doubt to my mind that it's not just like a flu. It does seem to be particularly nasty. It's nasty. But on the other hand, it does seem to afflict particular groups and particular ages in on that. And so Canada's foremost sociologist, Reginald Bibby, at least to my mind, he's certainly one of them. He's Order of Canada, that sort of thing. So it's not mere speculation on my part. He's demonstrated that 97% of the deaths have been of those of 60 and over. 97%.
And we've seen in larger municipalities, especially, well, actually not even in rural communities, it's the long-term care facilities where there's a community transmission between PSWs, healthcare workers, and the patients, and among the patients themselves. So we've seen those tightly woven communities of the long-term care centers where that's really where we see an explosion in the cases.
Right. Yeah, no, so the stats there now demonstrate that the threat is very specific for very easily identifiable communities, and they are the elderly. Those who are shut in have been particularly afflicted by the virus. So it's a terrible thing. Anybody with parents of that age is obviously anxious about them, and if they're in long-term care facilities, they're particularly anxious about it, and rightly so. The question,
especially when you can't even visit them. That's another dimension. That's another angle, but for another day.
You can't even visit them. You can't even see them. So they're isolated. They're alone, and they're obviously anxious, and that nobody seems to be able to visit them, provide sort of the solidarity of care of, this is my child coming to visit me. You can't do that. So it's an extraordinary situation. And the other thing extraordinary about it is that we have, for the first time in human history, we have quarantined the healthy and shut them down to avoid a threat, rather than, because now it's not just a war analogy, it's a sickness reality. A sickness, people who are sick historically, ever since biblical times, have been quarantined. Now the healthy are being quarantined. Is this a just?
Right. It is unprecedented, because I in doing some research, the 1968, 1969 influenza pandemic, known then as, or still today as, the Hong Kong flu. I mean, that eviscerated or wiped out about 1 million persons. It killed 1 million worldwide, I believe 100,000 Americans. And it was a huge deal. It was a huge deal, but still schools ran, concerts, social gatherings, obviously churches, places of worship, that all still continued. And yet here we are, 60 years later, 50 years later, and we see a completely different response. And healthcare then was still, fairly substantial. We had vaccines, we had that sort of thing. So it's not like we're comparing it to the Spanish flu when it was a completely different scientific climate, if you will. But I appreciate your analogy with the just war theory. So flush that out a bit more for me in terms of how you feel or don't feel that would apply now, that maybe those conditions aren't being met.
Okay, well, as I say, initially, it might have been acceptable because of the unknown nature of the threat. Now it's a known nature of the threat. And the rightful sovereign initially would have been the federal government, because the government has control over the borders. But it's now transgressed, it's gone over the borders, and now it's in our midst. And we have the reality that it cannot be stopped at the borders. It's in our midst. Okay, so in that situation then, who is the rightful sovereign that will be acting here? It can't be the federal government, because it's already passed, it's gone past their right jurisdiction. It's now gone into the midst of every one of us. And so to my mind, the rightful sovereign in this situation is the family and responsible adults, those who have been deprived of their rights and freedoms by the mandate of the federal government. And that seems to me an open question now, is whether that's the right response. And in fact, to my mind, the answer is abundantly clear. They have no authority.
And we've seen in news reports, the repeated fumbles, as you mentioned, the one about the border, but they're wearing masks, then don't wear masks, or then yes, masks are effective. And these continued flip-flops, if you will, on health policies by our federal government, by the chief medical officer of health. And I think many people said, they tuned it out a while ago, saying, I think they don't really have their stuff together. I'm going to make the decisions that are best for my family. That's why we saw, the run on toilet paper, the run on flour, things like this, because people were actually legitimately worried that this is here. This is not going to be stopped. What can I do to best prepare my family?
right. And who can blame them? And so the principle here, which I would like to bring back, which has basically been recognized throughout human society historically, and is certainly a part of the Christian tradition, is the doctrine of subsidiarity, which is that that matters ought to be handled by the smallest, most local, least centralized, competent authority. The least centralized, not the most, the least. And the decisions ought to be taken there at that level. Now, to my mind, at the moment, we're being told that it is illegal for us to do that. On what basis is that claim made that this is legal or illegal? Well, it only can take place in the context of the cessation of civil liberties. Now, these rights are not given to us by the government. These are rights and freedoms that we have by virtue of the fact that we're made in the image of God, that we are free human beings, and that we have personhood. And it seems to me that we've been deprived of those rights and freedoms at the moment. We're all suffering from that. There's a sort of a violation of human nature that's going on there. So there is an invisible threat, which is the virus. But now it's a known threat, and it only affects about 97% of the deaths are of those who are, as I say, 60 and above. So it really is a danger to the elderly.
And Scott, just to stop you there. So, some people will argue, they'll say, well, yes, that's true. The family unit should have their own sovereignty and be their own, unit and make the decisions best for them, for their family. But sometimes the risk is just too great to general society. You don't know. Children sometimes are showing asymptomatic. We don't know if they are intermingling at school, if they're going to pass it home and bring it to their grandparent. What is the fine line or the balance that needs to be struck between responsibility of local health departments and the sovereignty of the family unit?
Well, people keep talking about this, and I mean, you're right in a sense to present it as a fine line and as a balance to be struck. But that balance can only be found when we return, when our rights and freedoms are restored to us, as is part of our heritage, and quite frankly, as is due to our human nature. Individuals will find what the right balance is. So for my family, I will be able to determine how best to deal with this in relation to others. So I'll wear a mask, I'll wash my hands, I'll follow the advice that's been given, I'll try to maintain some distance. If somebody shows any signs of sickness, I'll obviously want to remove them from it. If they are sick, then they need to report that, all those sorts of things. Those things will happen. But if we do otherwise, we're going to have to bring in means by which that we're going to deal with it, which involve even further atrocities. So there are going to have to be laws that will be passed, and people will be fined for really silly and arbitrary things.
Well,
so
they already are being fined. I remember reading in earlier days in Ottawa, there was a father with a child who was on the autism spectrum, and he really needed to get out of the house and just run. And the child was running in an open field, and the father was ticketed. And so when you talk about the family making the best decisions for the family, that parent there felt the best decision for his child because he was going stir crazy. And, he had obviously other conditions, but, is to get outside and do that run, because the harm by not doing that would have been probably far greater. So I appreciate that, there are people, like obviously parents, usually they're in the best situation. They are the best decision makers for children in this case. So they're already ticketing. I was even stopped the other day. I wanted to go for a hike through the woods. I thought the trails were open, but apparently only select trails were open. So I was turned away with my children, and luckily not ticketed, but yeah.
And why that trail and not another? Again, it's just totally arbitrary, and nobody can know. And so everyone feels like quite frankly, their normal living arrangements, which we would grant to basically every individual. How will I be able to judge whether something I'm doing is legal or illegal? Well, I won't, and neither will the police officers, for that matter. They're out to sea on this. So everybody is working in uncharted waters. And what's alarming to me is this is being called the new normal. Well, my question is, who said that this is the new normal? I know that the government is saying this to some degree. And I know that other people are now parroting and using this language of the new normal. But the new normal is of a lockdown, of effectively being under some measure of house arrest, and some businesses and enterprises are being considered essential services and others are not. By what standard are some essential and some not? Who gets to decide that? It's certainly not the individuals who have rights and freedoms, which are been granted by God. These have not been granted by the government. The government has acknowledged them, but they hasn't given them. And so, and when it comes to its expertise, well, initially we were given computer models for the threat of the virus. Here's my question. Where are the experts' computer models of the effect of throwing millions out of work, closing schools, denying rights and freedoms, destroying small businesses, and quarantining healthy populations indefinitely? Where is the computer model of the effect of that? So if we're going to say this is a good policy, by what standard are we going to measure that it's a good policy? That, to my mind, there have been no such studies done, and they're going for it and saying we have a plan, but there is no roadmap, and they don't even have one themselves. So at this point, I'm thinking,
all sort of stuck in limbo. Like, are summer camps on? Are they off? Is school starting in the fall? Is it not? Oh, now we sort of across the country know that schools most likely, most of them, I guess in Quebec they've opened, but they're not going to be returning. And if and when schools do open, there are going to be some drastic social distancing and very drastic measures. I saw some photographs out of France and how they're handling the school situation with children, and it sort of looked almost like jail. It was quite strange. And, you know, parents are now wondering, do I actually want to send my child into that milieu? I know everybody's trying their best, but is this actually the best thing for my kid?
right, and it's not just that. The original rationale was a health threat. What are the health threats of being under quarantine for a long period of time? Domestic violence, suicide rates, drug addictions, despair, anxiety off the charts. And I mean, we're only, as you said, 11 weeks in. What is that going to look like over the long term? I think that this is a catastrophe in the making. And the problem here is that the officials that first declared this are now in a position that they have to solve the problem. So again, I'm attentive to language on this. It began with, we need to slow the spread. We need to flatten the curve. Well, I just heard today the Ontario government said that together we can stop the spread of COVID-19. Well, that contradicts what they said at the outset. That they said that we can't stop it. We have to. There has to be remediation, so we have to slow it down, but it can't be stopped. And of course, it can't be stopped. It can't be stopped until it stops itself, basically. Or we have to wait around for the vaccine. But there's no guarantee that a vaccine will be made. And if it is, the virus is going to mutate anyway. So it won't be. I mean, they won't even know what vaccine to use on it. So it's a grand social experiment, and the evidence is already in that the effects of it are harmful. It's devastating our economy. And I just read the other day that they project that hundreds of millions are going to die of starvation in the third world because of the slowing of the economy. And so this is we're no longer speculating on the possible ill consequences. These are known evil consequences, which means that the just war is now an unjust war, I would say.
It is an unjust war, and it could very well be an unjust war. And if you think about all those the fallout, if you will, of keeping people under quarantine like this, at least in North America, the amount of deaths coming from domestic violence, drug overdose, suicide, just general mental health precautions, plus having people isolate in place for so long that their immunity might be a little bit weaker now when they do reemerge into society. I mean, I'm concerned that the emergency rooms are going to be flooded in a few weeks if they open them up. So then you wonder, well, actually, will that death toll be far greater than actually the corona death toll? So I guess, you know, time will have to tell. But I've spoken to people, like I speak to many people all the time, and spoke to a girlfriend of mine, and she said, you know, her father, who escaped communism, chirped that this was worse than living under the communists. He said, at least I could leave my home. This is, you know, he's elderly. This is, you know, he's been told to stay in place, and this is just too much. This is just too much.
Well, I mean, what you raised 1958 or 1968, both of which were pandemics. Some have also likened the Spanish flu, in which there were huge losses. Of course, those losses were in the able-bodied working population, unlike this one. But it appears that the threat or the virulence of COVID-19 is nothing like the Spanish flu. It's probably like the other two pandemics. And so what is the difference? I think it is the influence of technology. People who have certain positions, let me say administrative positions, can continue on to work in these conditions, whereas your average working individual, your mom and pop store or your local business, they can't work. So they're going to go out of business. Well, then they'll have to depend on, again, the support of the government. Well, where are they going to get the money from in order to do that? I mean, 1/8 of Canadians have suspended their mortgage payments till September. What's going to happen come September? So this is a devastating economic destructive course of action, which the governments have brought into force, and they're not willing to pull them back. So this begs the question, if I can just say this now, this is me being a little bit technical here, but it seems to me the real issue here is that our view of human nature, all threats in our government's eyes are pathological. They don't require justice. So I talked about a just war. Now they're not trying to do the just thing. They're trying to cure the situation. We're going to solve it entirely. And the only way that we can judge that success is if we can give the experts all of the decision-making power to determine whether it's been successful or not. So we've cured the problem, they will say, but all notions of justice have been thrown out the window. And my final concern, you raised the communist thing here. It's been demonstrated that when we give powerful people absolute power, they do bad things with it. What makes us think human nature has changed? Do we really think that our government is more compassionate, more just, more competent than any of generations past? Do we really think that?
Well, I think you and I both know that history repeats itself, and it repeats itself often.
And it repeats itself awfully. And there was a quote from Mark Twain. I don't know if I'm going to get it, but he said something to the effect of, he said, it's easier to fool people than to convince them that they have been fooled. So that's our challenge right now, is to convince people. I'm not sure they've been explicitly, intentionally fooled, but they have been mistaken. But now the governments don't want to admit they've been a mistake, so they're going to double down on it, and they're going to keep on. And if you look at the numbers, the population, the politicians are very popular right now. They're not going to be in about 6 months' time.
That's what scares me when I saw that the federal Liberal government under Justin Trudeau, that if there was an election today, he would have a healthy majority. And I thought, oh gosh, that's an interesting thing to think about right now, because, just 6 months ago, we were dealing with blackface and lab scam and all those scandals that were revealed before and during the election. And then we've now tanked our economy so severely, rightfully, wrongfully. I think we've chatted that probably most likely wrongfully. And what is this going to bear for our future?
And it's certainly going to mean that our children are going to be disproportionately affected by this. And the weak and the vulnerable, I think, will be disproportionately affected by it. But those who have financial means are going to find that there's a lot of devalued assets out there that they can purchase at a knockdown price.
Anyway, Scott, I'm going to cut you off there because you and I can chat longer, and I would love to circle back with you maybe in a couple of weeks. We may discuss the philosophical impact of the economy with COVID-19 or something. I'm sure you and I can chat for hours. But anyways, thank you so much for joining me. Once again, that was Dr. Scott Masson. Thank you very much, and we'll see you next time.